Hi, Dr. Shahpur.
Hi, how are you?
It is, I'm good. How are you? Well, as good as we can be right now,
Yeah,
trying to
yeah,
hang in
same.
there. I've since gotten out of New York City, so I'm staying with family like, 2 hours away, so that's nice. But this is actually perfect because I feel like it's been 4 weeks since our last talk and our video did so well. Like my community on YouTube really loved it. So I'm excited to just give them some like good, reliable information. I think it was just so like to the point and realistic, but also like what can we do? Like optimistic too. So I think like it's a great theme to keep here. So I guess the first question is like, since we last talked, have we hit a peak? Have we started going down the curve? Because to be honest, I don't watch the news because it really gives me anxiety. I have bad dreams every time. I just want to know the facts. I don't want all the politics involved. So what's going on with the curve?
Yeah, I think it depends on where you live in the world, where you are in the peak. Places in Asia have passed the peak, most of them. Europe also seeing the same declines. And then parts of the United States, like New York City, for example, the case counts are declining, and we could say that we're past the peak of the initial wave. Um,
In New
Understanding
York
that
or
there
the
might
US?
in New York. I think
Okay.
other parts of the United States, they had different times in which they'd put things like shelter-in-place orders on. And so some did it earlier, like Washington, California, and then New York, and then some more recently, like Florida and other parts of the Midwest. So they might see their peaks coming a little bit later. But in terms of California, Washington, New York, I think there's consensus that the worst is over from the standpoint of, say, hospitals being crowded and things like that. With this first peak, and hopefully we've taken steps that if we relax measures, that if we see a rise in cases again, it won't be as bad. That's the hope.
That's the hope. Okay. So, but obviously if we're closed and other states haven't, but then they could still, we're all still one country. So they could technically still bring it over here. But, the hope is that everyone just follows suit.
Yeah, I think, yeah, certainly we wish we were on the same page in terms of the US, in terms of closing at the same time, all being in the same kind of period of the wave of the disease. That
Hmm.
hasn't happened, but yeah, there's a risk of, say, somebody coming from a state that hasn't closed yet and coming into, say, New York or California or Washington and introducing new spread.
Okay, you just mentioned the first peak. So obviously there's a lot of talk about this kind of slowing down in the summer and coming back in the fall. I mean,
Mhm.
even though there's no direct test, I know with like the antibody test, we don't know if you can get it again. It's got to be a little less, right? Like that's just how viruses
In
work.
terms of the peaks later,
Yeah, like it can't be as bad as it is this time.
I think it really depends on our behaviors and how much we retain, like what we've learned about kind of physical distancing, from this initial wave. And I don't think when we go back outside again, it's going to be the same as it used to be. It's just not going to be that way. People are going to kind of retain their reluctance to say shake hands or give hugs right away.
Of
And I
course.
think that that's smart because the virus is still out there. So it could be worse if we all just went back to how we're used to being and didn't have any measures like not washing hands, no hand sanitizer, these kinds of things. But I don't think that's what we're going to go back to.
Hmm.
And that's smart. And so we can continue to kind of take practical steps to avoid getting infected. I think the challenge is that the virus will still be out there, and most of, say, the United States has not been infected. So there is still this pool of people that could get infected, and it's really
Right.
about how do we continue to try to minimize that transmission, even if we go back to work and do other things. We do it in a safer way.
That's such a good point because so many people have been infected, but most of us haven't, which I think we're forgetting. So there's still that risk when things open back up that
Yeah.
it's still going to be there. So I actually have a question about hand sanitizer because so I'm a pharmacist by trade,
Yeah.
and a bacteria is a bacteria and a virus is a virus. So if hand sanitizer is antibacterial and the virus is only, how is that really, I'm confused how that's killing a virus.
Yeah. I think to be honest, I don't have the pathophysiology off the top of my head, but we know
Okay.
that the disinfectants and hand sanitizer are effective, probably disrupting the viral envelope and causing the virus to
Okay.
essentially not be pathogenic anymore. But I don't know
Okay.
around it.
So they're helping. I mean, it's not like there's an antiviral soap, but today, as I was like thinking of these questions and organizing them, I was like, wait a minute, like if I really think about that. So I just wanted to make sure. I mean, what else are we going to do? So I guess that's okay. That makes sense.
Yeah, I mean, I would think of it more as antimicrobial. So whatever
Okay.
the microbe is, bacteria, viruses, it's, certain, these products are effective in killing, 99% of them.
Okay. So for anyone like who like a microbe could be technically a virus or a bacteria versus
Yeah,
antibacterial. So that's a good way to look at it.
yeah, yeah.
Okay. If you know someone that had it, let's say they tested positive, what's the safe time of when can I see them again? Like my assistant, her boyfriend, someone in his family had it. So like when can she see him? She hasn't seen her boyfriend in like a month, which is responsible. I respect that.
Yeah, so if somebody had it, there's guidance, say on the CDC website, about when they can kind of come out of isolation. Usually it's after a certain period of time, say several days of having no symptoms.
Okay.
If somebody was hospitalized, then part of hospital protocols to be discharged in many parts of the world are to have 2 negative tests so that you don't have active virus, evidence of that, and you don't have symptoms. Then, kind of on the subjective side, no fevers, no coughs, those kinds of things, but also, based on the swabbing, not having any evidence of virus, then that would be somebody who could be discharged. That's kind of the
Okay.
criteria that's been in place in most parts of the world. So essentially trying to remove any possibility that they could give it to somebody else.
So I guess it's less of like because I guess, yeah, if you get symptoms and then you wait 14 days, but you still have, you can have it for longer than 14 days, just to be clear, like you can have the virus for longer.
It is possible, and some people have an extended duration. So it's less about, say, a day cutoff if you've been ill, more about when you start to get better and recover. And that can
Okay.
vary from person to person.
When do you think things will really go back to normal, or will they ever?
Yeah, they will when we have vaccine and if it's effective. So
Okay.
if we have the ability to protect the population with vaccine, then, and it shows that most people who get vaccine, or a majority of them or a high percentage of them, don't get infected, then I think, we have the ability to go back to what we used to be, or at least close to it. I think whether or not that's a vaccine that changes every season due to the virus mutating, or if it's one vaccine that can be used, for a longer period of time, we don't know those kinds of answers yet, but it's really about when we get a vaccine.
This first vaccine obviously takes a long time. If we need to alter the vaccine to fit mutations of the virus, is that something that can be done quicker, or is that going to take another year every time?
I think it can be done a bit quicker, but it's still not a fast process because it's a new product and we need to do some testing on it to make sure it's effective. But, like every year we have a flu vaccine that targets different pathogens, different types of flu that we see, that we know are coming that year. So we change up the mix a little bit. And that's done on a yearly schedule. So it depends on how, what we see about coronavirus and how it's changing in terms of vaccines, say after the initial vaccine.
Okay. I have a question about vaccine versus treatment. So I obviously understand that a treatment treats and a vaccine prevents. So in the vaccine, essentially you're getting strains of the virus that are inactive, I believe, right, to help you build antibodies and protect you from getting it. So for like the flu, we have Tamiflu as a treatment, and we have the flu vaccine, the flu shot. So do you think we will come out with a treatment first? Like, is that something easier to create?
Yeah, there's a number of treatments already under investigation.
New drugs, not like hydroxychloroquine, like the old drugs, right?
Yeah, or there's drugs that have been used for other things, antivirals for, say, HIV, and other things also are a part of that, Kaletra being one of them. So there's drugs that are under investigation that have other uses that we're looking at that potentially they can be helpful for this. And those studies are ongoing. There's large clinical trials involving multiple countries, and we could get some of the results, within the next 1 to 4 weeks from some of those studies. I think you've seen some media articles about maybe this one's working. Last week there was an article about a product that potentially was having some success in severe patients. So there's a lot of hope there, and that information will come sooner than, say, a vaccine is available. So the hope is, ideally that in the early summer, late spring, potentially some candidates for treatment that have been shown to be useful. And they can also be potentially used for prophylaxis, not just treatment. So you might take a medication that can prevent you from getting disease. There's other examples of that.
Okay.
But we just don't know. But we anticipate that'll be sooner on the timeline. than
I mean,
vaccines.
could that be better? Not better, but like, is a vaccine better, or like, could that really help slow things down as a treatment too?
Yeah, it could help. It could help if it's very effective. It depends on what it's effective at doing. Is it effective at, in the most severe patients, or is it effective in reducing the duration of symptoms or the severity of symptoms in everyone? That would be great. If it makes
Right.
if it makes the spectrum of illness, instead of going from very mild or not having any symptoms to very severe, just be mild for everyone, then I think that would potentially change the way we've implemented some of these other measures to try to
Yeah.
prevent infection. So, but
I
we
mean, I
don't know
know, like,
yet, but it's hopeful. We're hopeful.
like for me, it's like, if you told me I'm going to be sick for 3 weeks, but I'm not going to die, like, I'm happy. Like, so so
Mhm.
obviously taking the severity of symptoms down means like you won't get to that point where you're at risk for death. I think that would calm a lot of people.
Yeah,
Right.
yeah. I think we still would just have to think about things like protecting or shielding parts of the population, because
Hi,
I
you mean
know,
like
like
the
older
risk?
people,
Right.
yeah, immunocompromised, those sectors of the population. Because, yeah, I mean, I think that you, hopefully me, if we got sick, it wouldn't be too severe.
Right.
But we also don't want to come into contact with, say, our parents or other people, and then have them have severe illness, because that would be unfortunate, of course.
If you're a healthy person who's under like 55, 60, like, you're very low risk to die, right?
Yeah, I would say the very low risk is probably under 40.
Under
It's
40.
not, yeah, it's
Like,
not, I mean, it's a gradient. As you get older, there's a higher likelihood of having severe illness. But you start to get into the more than 1 in every 100 people, unfortunately, passing away, in the 50s, 60s range, which is a lot.
okay.
If
And
you multiply by thousands of people.
yeah, I mean, it's a lot. The numbers are high. And when it says someone with heart disease, does that mean somebody with high blood pressure? Like, what if their blood pressure is controlled on medication? If they're on like a 10 milligram Lipitor, are they still heart disease technically?
We don't have great studies looking at the other comorbidities and how much they contribute to COVID severity. Most of the studies have looked at, there's 1,000 people with COVID, and 900 of them had hypertension, right? But the thing is, most of the people have hypertension in the community, so it's hard to know whether or not hypertension was contributing, or high blood pressure was contributing to their disease. We need to do controlled studies that look at things like, okay, given the age distribution, given the sex, what is the impact of having diabetes or heart disease? And there hasn't been many of those, and we need more information on that. But hypertension in and of itself isn't necessarily identified as a risk factor yet. It's more
Okay.
about structural kind of heart problems and things like that.
So different, even though it's technically under like heart disease, it's not what you're referring to. Well, most what they're referring to.
Yeah, it's a TBD.
Okay.
Yeah.
Okay. So Anthony Fauci said he doesn't think Americans should ever shake hands again. And weirdly, I've always been a little weird about shaking hands. Like, I know when I go to Dry Bar to get my hair done, this is going to sound, I literally pretend I have some, because they come, oh, hi, nice to meet you. And I don't want to look rude. But something about it has always grossed me out. So I like pretend to have something in my hand. I strategically will like hold my phone and jack it and be like, sorry, I can't. Like, what are your thoughts on like handshaking moving into the future? Do you think we should just stop doing it?
I think there's definitely going to be less handshaking and more
Right.
hand washing at the same time. In general, I think the main thing is it socially acceptable to not shake hands and not be rude about it. And I think
Right.
overall, people are probably more aware now that, you're not shaking hands, you're doing it for the reason of not trying to spread disease rather than just trying to be rude. So I think hopefully it'll be more acceptable not to shake hands, but maybe greet each other a different way.
Right.
It's a challenge though when somebody sticks their hand out and says, how you doing? And then you're kind of like, you feel bad if you don't do it. And so
Do my trick. Always have something in your hand. I mean, look, if it's like like I'm going over to someone's house for dinner and I don't know them, like it's a little bit different, but there's something just about like in the wild, wild west, like out there, random people, like, I don't know. I guess maybe I'm being a little extra with that. When there will be a vaccine, right? Like, it's not like an if, like a vaccine's coming, please.
I think there'll be vaccine. We just don't know how effective it'll be. And what it'll be, in terms of how many people will be protected who get the vaccine. We know vaccines for things like the childhood immunizations are very effective in terms of their protection, versus flu vaccine we see sometimes fluctuate between 50 to 60%. on a
Yeah,
given year. So
true.
where does the COVID vaccine sit? We don't know in terms of how effective.
So let's say the vaccine's tested, it's safe, like they're ready to give it out to the public. What's the protocol? Like, what are they thinking? Like only over a certain age? Like, does everyone just go get in line for this vaccine? Like, how does that look?
Yeah, I mean, I think first off, it depends on the safety data from the vaccine trials. You know, what population is it safe to give? Is it safe adults, children, those with comorbidities or other underlying conditions or not? How safe is it? And that'll determine who gets it. And then I think practically there needs to be some prioritization. Potentially, say healthcare workers, for example, might need vaccine first if we have a limited supply. But it'll be a huge logistical challenge to get vaccine out at to the entire population, for example, right? But these are the things that should be worked on right now. They are being worked on. They should continue to be worked on. Kind of like the testing in general, getting tests out, getting vaccine out. If we find a medicine that works, we need to figure out how to manufacture that medicine and get it out to as many people as possible. And that, whether or not it works, it's a challenge to get it out to everybody, right? And make sure that we do it in an equitable fashion.
You're saying should be. Is it being worked on right now? Or I know you're saying.
Yeah, it is. It is being worked on. But you see challenges. Even with the testing that's been rolled out in terms of the number of tests and who gets them, and we still don't have enough. We know that there needs to be massive testing in place, especially if we reopen things up. In terms of society and getting out there, it's important to what we call have eyes on the virus. Who has the virus? Let people know. Give them results fast. They shouldn't go get tested and then wait around for 5 days to figure out if they have it or not. In those 5 days, they could infect other people or not know what to do. So we need timely testing, at scale.
In terms of the vaccine and coming up with something, I think I asked you this last time, but just so I'm clear, is the world like working together? Like, is Australia and America and Italy and the UK, are they like all on the phone? Like, I've got something. What do you got? Like, how does that actually work?
Yeah. So I think on treatment and vaccine, the world is working together.
Okay.
This is really a humanity against the virus approach.
Right. And I'm hoping that's what they're doing versus like, well, if we get it, we want to make money. Like, I don't know, we don't really know what's happening.
Yeah. I mean, on the treatment side, there's something called, for example, the Solidarity Trial, which is coordinated by WHO, the World Health Organization, has multiple countries involved in this trial, patients from all around the world, which is good because then we can see how it works in different populations, different types of people from all around the world. So they're evaluating a number of different medicines to see if they work in treatment. And then in vaccine as well, there's a group called CEPI, the Coalition for Epidemic Preparedness Initiative, I think is the acronym. And essentially they work to make vaccines for things that aren't necessarily profitable, but can have a large impacts on, the health of humans. So they've taken this on. It's a coalition by name and really trying to get the best experts to come together and come up with good vaccine candidates. And there's also companies like Johnson & Johnson and others that are working on vaccine candidates. Everybody's trying to race to get something out to everybody in the world that works.
Okay, that's fair. Just to kind of go back to the second wave, because I think that's been a lot of talk lately about the second wave and if everything's going to happen. What is the prediction there and like what it will look like in fall?
If we start to see it creep up again, then we might need to turn some things on again when it comes to physical distancing. It's a back and forth. It'll be a back and forth, turn things off, turn things on, look at the spread of the disease, look at how full the hospitals are, and balance it so that we let people do essential things outside again safely, but we also are ready to act if it starts to look like it's going to get out of control again. And some Asian countries are going through this now because they had it earlier than the United States. So countries like Singapore, Korea, Taiwan, Hong Kong, they're turning things on again or off again based on what they're seeing with the spread of virus, and going through the second peak and things like that.
And is that where it's more like economically we need to do that? Or is that the ideal situation, is to kind of obviously ideally for the virus, it'd be like everyone stay home until we have a treatment, but we can't do that. So it's more just being realistic.
Yeah, I think we can't shelter in place forever. So how do we manage to kind of have society reopen safely? So when we reopen and people start to get sick again, if we have the ability to take care of them, then that's a good thing. But if it starts to get, the ICU is getting full, the healthcare workers can't be protected, then we should probably shelter in place again.
Do you think that schools will be open in the fall, or do you think they're going to just stay closed until, because I mean, that's talk about like everyone in one room and like colleges and high schools, elementary schools. What do you think?
Yeah, it's interesting. I think it'll be, so schools were identified as not necessarily the first things to reopen, but maybe, I think the White House said phase 2.
Okay.
I think they wouldn't reopen exactly the same way they used to be open. So perhaps if there's elderly teachers, for example, they wouldn't be interacting with the students as much, or not even, may not even be a part of the school workforce in this fall at least. Certainly good precautions at school, hand washing, making sure you stay home if you're sick, all of those things would be in place, would be important. There's a potential for schools to reopen, certainly. And a part of it will also depend on what we learned about children getting infected. We think it's milder. We think that, we know that based on the information we have, but we're going to get a lot more information between now and say September when schools reopen on what does the disease look like in kids, and how much do kids really transmit it to others? That's another question.
Okay. Restaurants, like, coffee shops, like, I mean, I can't, even like big trendy restaurants, like I can't see them reopening, right? Like what do you, has the CDC or has anyone like talked about what that will look like? Because so many are going out of business. It's scary.
Yeah, I think, we start with things like takeout only or delivery, which is going on now. And then if they are going to reopen, again, not the same way that they used to be. So in Asia, restaurants have reopened in some places, and they do it by doing temperature checks when you come into the door.
Yep.
Making sure the tables are farther apart from each other. Making sure that they disinfect surfaces so the tables themselves are cleaned very well. These will all be measures that will be important to have restaurants be able to reopen.
I think the last question to kind of bounce off of that, you and I actually talked about this privately, but I'd love to share it in a video. Yeah. I was asking you that I was concerned about ordering food. I was really wanting takeout from this, like this soup from this place. And I was like, should I not do it? And can you just explain in terms of like eating, can you contract the virus versus like, is it safe to order food out?
Yeah, I think, so the safest thing is to not order anything, right? Not to bring anything into your house. But to understand that the risk of, say, getting it, if you receive food in your house, the risk of getting it and getting COVID is not that high if you take proper precautions. And most of that is around contact with the people bringing it to you. So removing that from the possibility in terms of getting disease. So people should be dropping things off and you not interacting with, say, the driver, for example, or the delivery person. And then once they drop something off, the package itself, if you assume that it's contaminated, then you'll deal with it the right way, which is essentially to wash your hands after you touch the package, perhaps transfer things out of there and remove the package as soon as possible. With cardboard and things like Amazon deliveries, we know that the virus lives on cardboard for a matter of 24 hours, essentially. So if you get a package and you don't have an urgent need to open it, you could leave it in the garage or by your front door for a couple days until the virus isn't viable anymore, and then open it more safely.
That's what we've been doing.
Yeah. So these kinds of measures will help reduce the risk to essentially a very, very, very low level that you really shouldn't be too concerned about.
And the actual food though, eating the food, like how does that work?
Yeah, so food, I mean, ideally, you're not getting it near your the other parts of your face, like your nose or your eyes and these kinds of things. It's just going in your digestive tract. There haven't been any large studies or any case reports that I've seen on foodborne transmission of COVID. So we don't think that you can contract COVID by eating it. And I wouldn't worry as much about the food itself as I would, say, the containers that it's in. Because you don't know at the restaurant, say, if they're wearing a mask or wearing gloves when they're preparing, you just don't know. So you can assume, if you assume that maybe that they weren't, then you'll just be more careful about maybe transferring the food to a container in your house, for example, and then from then on interacting with that, and don't worry so much about the food itself.
So yeah, if you do order food out, completely Lysol down or whatever the containers, pour it into a separate bowl, wash your hands, and then eat it. And if you want to be extra safe, don't get it near your nose or eyes. Like just try to get it into your mouth because less
Yeah,
risk of
maybe no
eating.
food fight.
No food fight, no
Yeah.
sniffing your food, no touching your eyes.
Yeah.
I think I've only ordered out food once in this entire like 8 weeks, but I got a little paranoid. So I know I sent you a text and was worried about it, but
Yeah.
I
And
just want to make sure
we
that
order food all the time.
okay.
Not like a lot, but once a week just to mix it up. But we do
I
it
mean,
safely when we get it.
you have kids too, like cooking, and I mean I've been cooking more than I ever have. To be honest, that's kind of been one cool thing. I've become really good at cooking, and I've
Yeah.
started to like get my joy for it again. Sometimes you just have to like get in that habit. So we can try to find a few positives in that too.
Yeah,
What
me
we can
too.
do.
I love to
Mhm.
cook, and that's been one of the positives, just to be able to
Yeah.
do it.
And I'm like learning new things. So okay. Well, this was again, I think you have like a very calm demeanor about it, which is nice because it's like realistic but calm. And I think that's what we need. So, at least for everyone watching this, when we do reopen, to still use caution because, there probably will be a second wave, but at least it's really like we're in control of it. So I really want everyone watching this to not like once they open things to just be like, we're good and like assume they can go back, because like we have to all work together until there's a vaccine in place.
Yeah, thank you. It's great. It's important to be informed, even as individuals. We can't assume that's just because, say, the government where you live says we're going to reopen, that everything is safe. That's not the case. Having good individual practices, taking care of your family, these things will all help you no matter what, rules are going on around you. And it's just good practice to be informed. So thank you.
Thank you, Dr. Shahpur. Maybe in 4 weeks, we'll have you back for another update. Maybe, who knows, maybe in 4 to 8 weeks when things reopen, we can get back on and just keep going until this is over.
Happy to join anytime.
Okay. And we will, I'll pop up your handle right here. Instagram is where you're putting out some good, like factual content right now, right?
Yeah.
You're getting there on TikTok. It's slower, but okay. Well, thank you so much. And thanks for taking the time. I know you're busy and we appreciate you, and we'll talk soon.
Thank you.